How to get low-cost tooth whitening. If you want to whiten your teeth affordably, you're probably going to need to do it yourself, with the possible exception of a dental school. Most at-home treatments are under $100, while professional dental treatments can start at $500. When looking for at-home treatments, you have the option of over-the-counter treatments or homeopathic treatments. Method 1. Using over-the-counter treatments and other options. 1. Try whitening strips. Like other over-the-counter treatments, you can buy whitening strips from the store. As their name implies, they are strips that fit over your teeth. To use, you cover the front of your teeth with the strips and then leave them on for 30 minutes. You must do this every day for about 2 weeks. Make sure that you brush your teeth before you use the whitening strips. This will provide better strip-to-tooth contact, which should improve your results. You'll need to do this treatment about 3 times a year. While this option is one of the more expensive ones for over-the-counter treatments, it is somewhat more effective than other over-the-counter treatments. 2. Think about whitening gels. Another option is paint-on gels. Basically, you apply the gel to your teeth with a small brush. You also have to leave this gel on for about 30 minutes. Some of these types of whiteners are simply a pen filled with the gel that has a brush on one end. Usually, you apply the whitener once or twice a day, with about the same effectiveness as strips. It can be applied to just 1 or 2 teeth, if you need it. Also, one disadvantage is it can come off pretty easily after you've brushed it on. The gel is usually not strong enough to cause tooth sensitivity, but it is still important to avoid placing the gel on your gums to avoid causing any burns. 3. Look at whitening trays. With whitening trays, you place a whitening agent in a tray, and then you put that on your teeth. You leave these on for a period of time, then take them off. This method can be more effective than strips or brush-on gel. The best kind are the ones that you mold to your teeth at home. Some are not designed to be molded to your teeth and therefore are harder to keep on. However, trays that your dentist make will be more effective, as they will be made to fit your teeth, allowing the gel to spread equally over your teeth and stay coat the entire tooth surface. 4. Consider whitening toothpastes. Whitening toothpastes may not be as effective as other options. However, they can provide some results, and they are by far one of the cheapest options. Whitening toothpastes can use special abrasive material as well as chemicals to whiten your teeth. Toothpastes do not contain peroxide, like some other whitening options do. Use a whitening toothpaste to replace a normal toothpaste. Use twice a day, and you may see results in a month to a month and a half. However, look for a brand that's approved by the American Dental Association, as others can damage your teeth over time due to the abrasive ingredients used to remove stains. Toothpastes with blue covarine may show results more quickly. You can also follow with a whitening mouthwash. 5. Find a dental school. One way you may be able to get professional whitening for less is at a dental school. As dentists are learning, they need to practice their skills. Because they are practicing, services will be at a discounted rate to you. Check with your local colleges and universities to see if there is a dental school nearby. All student dentists will be under the supervision of professionals, so you will be in good hands. Method 2. Using at-home homeopathic treatments. 1. Think about hydrogen peroxide. Some people use hydrogen peroxide to naturally whiten their teeth. In fact, hydrogen peroxide is often used in whitening products. Swish it around in your mouth. Make sure to use food-grade hydrogen peroxide. Only leave it in for a few seconds, then rinse it out. Be sure not to swallow it. Do not use hydrogen peroxide more than 3 times a week or for more than 4 weeks in a row to avoid tooth sensitivity, which is likely to appear with prolonged use. If you have a soft bristled toothbrush, then you can even brush your teeth while holding the peroxide in your mouth. 2. Consider activated charcoal. Some people have had luck whitening their teeth with activated charcoal. Activated charcoal is charcoal that has been processed with oxygen. It's also been mixed with zinc chloride or calcium chloride. Activated charcoal is highly absorbent, which is why some people have had luck using it with stains. Start with an activated charcoal capsule. Break it open to pour out half in a small dish. Wet your brush, and dip it into the charcoal. Use it to gently brush your teeth, then leave it on for a few minutes. After you're done, rinse it off. Use your regular toothpaste to brush your teeth. 3. Mix lemon juice and baking soda. Some people use this method to whiten their teeth naturally. They simply mix equal parts of lemon juice and baking soda to form a paste. Try to wipe the saliva off your teeth before applying. The mixture will fizz up at first. Once it's done fizzing, brush it on your teeth with a toothbrush and leave it for a minute. Use your toothbrush to take it off, then rinse. Only apply this mixture once a week, as any more may damage your enamel over time. You should have whiter teeth after 4 to 5 weeks of using this process, but do not use baking soda and lemon juice for more than 2 months in a row. 4. Try crunchy veggies. Eating crunchy fruits and veggies can naturally wear away stains over time. Also, most vegetables and fruits are acidic, helping to reduce stains. Any crunchy vegetable or fruit will do, as long as you eat them raw. Think about carrots, celery, jicama, and bell pepper, for instance. Apples are also good. They have malic acid in them, which is found in some whitening products. 5. Cut down on stains. One easy way to help keep your teeth white is to cut out things that stain your teeth. If you can avoid the things that stain your teeth, you can help keep them whiter for longer. For instance, cutting out drinks like tea, coffee, and wine can help. Pretty much any dark food, especially drinks, can stain your teeth. Consider using a straw to help cut down on the contact with your teeth. Also, avoid things that may stain your teeth for about 3 days after you have had oral hygiene done in a dental office. Tooth scaling creates retentive areas in your enamel, which need to remineralize. Cigarettes and other types of tobacco are notorious for staining teeth. However, you can avoid all things that stain teeth. For instance, trauma, age, and certain medications or treatments can stain your teeth, such as chemotherapy. Warnings. Always consult your dentist before beginning any whitening treatment. Whitening products, particularly bleaching products, can make your teeth more sensitive.